Yeah, thank you. Just want to also recognize we've been joined virtually by Councilmember Caban, and we have also been joined by Councilmember Palladino as well. So before we get started with the testimonies, I just wanted to read a statement on behalf of Councilmember Hudson, who could not be here today, but it's about her bill introduction number 946, so I'm just going to quickly read this for number 946. So I'm just going to quickly read this for the statement on introduction 946, which is being heard today. Currently, 1 in 5 New Yorkers experiences mental illness annually, according to the Mayor's Office of Community Mental Health. And hundreds of thousands of them, largely Black, Latinx, and AAPI New Yorkers, are not connected to mental health care. As New Yorkers came out of the initial stages of mental health care is slowly eroding, many New Yorkers have no idea where to turn to receive help. Intro 946, first introduced in December 2017 by my predecessor, would require each city agency to have someone designated as its mental health coordinator. This person would ensure all agency employees know about mental health and related When the bill was heard last session, OLR Commissioner Campion said the agency's end quote. I hope the new administration follows in the steps of its predecessor and supports this bill's passage. I would like to thank Ms. Beverly Johnson, who will testify later today about her own challenges with receiving mental health support on the job, for her tireless work on this bill. She's the real reason this bill is being heard today, and is the reason this bill has 42 co-sponsors in the City Council. Thank you. And I will now turn it over to the Legislative Council to administer the oath.
Thank you, Chair. We will now hear testimony from members of the administration. Will you please raise your right hand? Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions? I do. Thank you. You may begin when ready.
Good morning, Chair Holden, Chair Lee, committee members, and advocates. My name is James Hendon. I'm proud to serve as Commissioner for the New York City Department of Veteran Services. Thank you for holding this hearing on mental health services for veterans. I'm joined today by Dr. Lauren DeMello, Executive Director of Mental Health and Care Coordination, remotely, Ellen Greeley, Assistant Commissioner for Policy and Strategic Partnerships, also remotely, and Paul Vallone, Deputy Commissioner for External Affairs. I'm also joined by Jamie Nicholas, Assistant Commissioner for the Bureau of Mental Health at the Department of Health and Mental Hygiene, who's available for Q&A on intros 0793, which requires the Health Department to report on referrals to assistant outpatient treatment programs, and intro 946, which requires the creation of a mental health coordinator to inform city employees about mental health support and services. Our veterans adhere to a military culture that values honor, courage, duty, self-sacrifice, discipline, teamwork, never giving up, holding oneself to a higher standard, physical and emotional pain, and often are reluctant to seek professional help. We at DVS continue to build a military culture competence system that is responsive to meet the emotional needs of service members and veterans across a spectrum of programs and services, as well as work with a multitude of community-based and behavioral health partners to improve their practice when caring for service members, veterans, and families. In building this system, we are aware that emotional health is a product of many factors we call social determinants of health. Think of emotional health as the dependent factor based upon a series of independent variables, such as socioeconomic status, education, employment, social support networks, access to health care, food insecurity, of our significant degree of our partnership work on improving military cultural competence programs. First up is Vet Connect NYC. Vet Connect NYC is a multi-service provider platform. Veterans can Disorder 7 and PHQ 9, or Patient Health Questionnaire 9, which screen for anxiety and depression respectively. Student veterans acculturating to college life, and veterans retiring from employment. These vulnerable veterans represent the largest group in committing suicide. Onward Ops, formerly known as the Expiration of Terminal Service Program, or ETSSP, identifies service members departing from military service, enrolls them in their programming, and assigns a mentor, usually in the same geographic area that the veteran is returning to, and also helps that veteran receive assistance, short for the Transition Assistance Program. DVS, at the beginning of this year, sponsored a virtual transition assistance program and separately an in-person program in collaboration with the Mets at Citi Field this past June. We organized panel discussions on education, job preparation and employment, VA benefits, disability claims, and housing. We plan to conduct a similar program for women veterans in the spring of 2024. Next program is the Joseph P. Dwyer program. The 2021 DVS Military and Community Family Survey revealed that roughly 1/4 of veterans reported that they feel lonely 3 or more days in a typical week. That survey can be found at nyc.gov/vet survey, by the way. It's at nyc.gov/vet survey. Social isolation has been found to be a factor in those seeking mental health services. To enhance social engagement, fortify emotional wellness, and encourage help-seeking behavior, DVS began a pilot program with State of New York funding for its own private first-class Joseph P. Dwyer program. DVS issued a request for information in February or March of 2023, and we received 21 responses, providing a broad selection of in-person arts, music, health and wellness, athletic, culinary, educational, and other community-based programs aimed towards piquing the wide interests of veterans and veteran family members of all service eras, genders, race and ethnicities, disability statuses, ages, and other demographics. To date, 4 programs are being funded. These include yoga at an American Legion of Veterans of Foreign Wars post in Staten Island, Zumba dancing at American Legion post in Brooklyn, rehabilitating an American Legion post in Queens, and offering equine therapy with Columbia University's Man of War program. In compliance with procurement guidelines, we will post a concept paper followed by issuing a request for proposals to distribute the remaining proportion of state funds. Our target date for posting that concept paper is early October. Crisis intercept mapping. Led by a VA and Substance Abuse and Mental Health Services Administration facilitator, DVS curated a group of representatives drawing from medical facilities, mental health providers, city agencies, colleges, universities, military chaplains, and nonprofit organizations to help community stakeholders visualize how at-risk service members, veterans, and family members flow through the crisis care system. Our community of practice discussions center on identifying stakeholders at various intercept points, such as first contact, acute care, care transitions, and ongoing treatment and recovery support. For food insecurity, since July of 2020, during the height of the pandemic, DVS has collaborated with HelloFresh, the Campaign Against Hunger, and Black Veterans for Social Justice to pack 2,000 food kits for approximately 1,000 service members, veterans, and families with these donated items. Each food kit contains 4 meals, so we effectively prep 8,000 meals each week. Over the 3-year period, we've packed more than 312,000 kits, translating into more than 1.2 million meals. Mission Vet Check. Vet Check is a buddy check wellness calling program. Thousand total calls with an approximate 25% answer rate, resulting in over 100 calls per week. Of those answered calls, DVS is proud to have been able to serve the over 1,200 requests for service since launching. These requests will range from food assistance to eviction preparation to mental health assistance to benefits, navigation, and more. Veterans Mental Health Coalition. The Veterans Mental Health Coalition is a group of mental health practitioners, researchers, and organizational leaders that meet once a month to discuss various topics on mental health. The group focuses on veterans' mental health concerns during each meeting and discusses updated research and data, treatments, organizations, programs, and accessibility of those programs and barriers to care. Yesterday's Mental Health Coalition meeting focused on substance abuse disorders. Next month's meeting will focus on post-traumatic stress disorder, and members of the committee are invited to attend. Military Family Advocate Program. This new program, is a joint collaboration between DVS and NYC Public Schools, where schools can opt in to have a designated member of their staff serve as the school's military family advocate. The designated person is typically a guidance counselor. Military family advocate training will be conducted at the beginning of October and halfway through the school year after the return from Christmas break. The training will consist of 4 parts. 1, military cultural competency and understanding the common concerns surrounding military families. 2, how to therapeutically engage with children and parents from those families. 3, how and where to access resources such as mental health treatment, employment, food, etc. And 4, ways to create opportunities throughout the school year to reduce stigma. The program will be piloted in Staten Island this year, and we will expand it to other boroughs in the following year. Additionally, with support from the Mayor's Office of Community Mental Health, DVS began to implement 2 health assessments known as the Patient Health Questionnaire 9, or PHQ-9, and the Generalized Anxiety Disorder 7, or GAD-7, to screen our clients for depression and anxiety. Since February of 2021, DVS staff have conducted more than 1,300 health assessments, for which approximately 28% indicated severe anxiety or depression. Since then, DVS has made 529 referrals for mental health services. This is 44 times the number of referrals compared to the period before the implementation of health screeners. Using these screeners further enhances DVS's ability to identify mental health needs of our clients, and accurately, this helps us connect them quickly to resources. DVS has also made suicide prevention among service members, veterans and their families, a top priority through our collaborations. DVS has sought and received trainings from experts affiliated with the U.S. Substance Abuse and Mental Health Services Administration and the U.S. Department of Veterans Affairs to develop a network of culturally competent, community-based organizations able to tackle the challenges of assisting returning service members and veterans who cope with physical and emotional distress, helping them and their families. DVS also supports the U.S. Department of Defense and U.S. Department of Veterans Affairs endorsed Onward Ops, or Expiration of Terminal Service Sponsors program. We support it by identifying community-based entities which can assist in recruiting and managing veteran and civilian sponsors willing to ease the reintegration of returning service members to their hometowns or new residential communities in New York City. We've been successful in enlisting the Staten Island Performing Provider System as a lead organization for this network and continue our efforts in reaching out to other suitable organizations, including the leadership of the American Legion and the Veterans of Foreign Wars. Anyone who would like to become a mentor can visit nyc.gov/vetmentor to sign up. DVS participates with New York State agencies on several working committees dedicated to improving health outcomes for veterans, including the VA and SAMHSA's Governor's Challenge Program, the New York State Suicide Prevention Center's Helping Those Who Help Others Coalition, and the New York State Office of Mental Health's launch of 988. In conclusion, we thank you for the opportunity to testify on this matter and look forward to any questions you or other committee members may have. Thank you.
Thank you, Commissioner. I'm going to ask questions off the script because I'm looking at them. And you mentioned, we were joined by Councilmember Williams, Botcher, Hanif.
If that's okay.
Yeah. Yeah, I just want to get your experiences because you're a veteran, and I want to speak rather than some of the script questions I have on these programs. My dad never, he didn't know that he had a problem. No, very few, I think, veterans, I still speak to a lot of veterans as I go around, and you just have to bring up their experiences to really get it out, and they kind of break down. Almost every veteran that I spoke to that was in combat has very similar experiences that it's inside them. So how do we get that out? I mean, you have Vet Connect, you have all these great programs, but how do you to the veterans? That's why the veteran service organizations I'm so big on, because they're all there together. But getting them to even go there is veterans to go and participate in the veteran service organizations. But first we have to save the veteran service organizations, but because that's kind of like, that's certainly therapy for them to talk to colleagues who had the similar experiences. And that's why it's very difficult that we're not getting support from the City of New York for keeping these veteran service organizations open. But in your experiences not only in the service, but in just talking to all the veterans, what would you say is the biggest thing that your agency is doing to really reach the veterans that need help, that don't know it?
I think the biggest thing for us, Mr. Chair, is trying to identify the vets, trying to find the folks so we can even get the relationship going. I always say in front of the committee, it's 24.2% of all veterans in this city actually self-identify. 29.6% in the state, 33.6% nationally. I'm sorry, I said it's less than a quarter of the veterans in this city self-identify. And so to me, a lot of the work is to try to identify our brothers and sisters in the shadows, the other 75%, just to at least get the relationship going. And if you have the relationship, oftentimes the mental health needs are going to come up through something else. Before doing this job, I ran an incubator for military veterans, had a lot of folks running their businesses who were dealing with all sorts of other things, but we bonded through them as entrepreneurs, and then when they got comfortable, other things came out and we were able to help them. And so I feel as though a lot of it is, how do we increase our service area where more folks are tied to us so that it increases the likelihood that they will open up at some point so we can help them in other ways. I think that's the key, is identify folks, Mr. Chair.
Again, these are major hurdles because they affect so many people. They affect the families. So every time I go to the Borden Avenue homeless shelter, which I don't believe should exist, I think we should not have any of our inns. They should be in supportive housing. They should have their own places. They should have transitional housing. They should not be in a congregate setting in a homeless shelter. We should give them a place. But when I do speak to them, and I mentioned it to you a number of times, that they all say they're not getting, other veterans in the shelter will say, people here need mental health treatment, and they're not getting it. They say they're not getting it. So I'm trying to get a program, I mean, in that shelter, and I'm sure you're doing it, where you can get them all together and talk about it, and try to pull it out, and have mental health professionals there to try to help, go over to the individuals, to the men, and say, let's have a meeting, let's have a private meeting. It's because then you could see they'll straighten out their lives. Some of them, again, 20 years. I met one individual, 20 years in the Marines, and he was in that shelter. 20 years of service to our country, and he's in that location for a long time, not receiving the mental health treatment. In the budget that we provide in the City of New York for mental health for veterans, what would you say is the main focus? And I think it's outreach, but what is, obviously treatment is important, but identifying it first. How do we do that on a greater scale?
Well, as far as identifying what we're working to do is make sure anyone who does provide some sort of services, social services in this city, that they're asking that question, have you served in the military? And if that person says yes, to make sure that they tie them in with us so we know who they are. Not just us, but also with our fellow agencies. It's something we've been working on for a while. It's also, we recently executed the agreement with the Speaker so that now, through Speaker Adams' office, every council member should receive, everyone that we have who is in Councilmember Bacha's district, or Councilmember Abreu's district, or Chair Lee's district, you will know who we know. And the idea is if we keep getting the touches up, that at some point when that person is ready to come and seek help, or ready to say, look, I want to talk to somebody, they can come to us. This stuff is nuanced because I have things I need to deal with from my time in Iraq I haven't yet, and I will get to that at some point. And it just takes time. And that's just me speaking for me, Mr. Chair. You know, so sometimes it's about, let's make sure we know who you are and start to work with you so that when that time comes, when you're ready to talk and ready to see somebody, we've got everything set up. And I think that's a piece of it. So a lot of it is just, let's keep identifying. We want to leverage everyone as far as, yeah.
But after they contact, what is the average length of time it takes for a DVS care coordinator to reach out to a veteran after they submit a Vet Connect request form?
2 business days, Mr. Chair.
Two business days?
Yes.
That's good. And tell me about the, so DVS coordinators receive mental health, do DVS coordinators receive mental health first aid training or similar training to help them identify training or similar training to help them identify?
Training coming up no later than the end of the year, but all of our coordinators are trained as far as mental health first aid, Mr. Chair.
So does DVS collect data on the number of veterans that utilize Vet Connect?
We do, and that's it's in what we publicly report also. So our 6-month look can be seen in Local Law 215 report. Our 1-year look, as far as annual, can be seen in our Local Law 44 report. We publish that at nyc.gov/vet reports.
Does DVS perform any outreach or public awareness campaigns about how veterans in New York City can access mental health and behavioral services? And we talked about this, like, I said, what about getting bus shelters and, how do we get the word out even beyond what we're doing? Because you have a database, and there's other ways to reach veterans. And I always said, like, bus shelter. I'm on a basic level of advertising, but there's, of course, the veteran service organizations are very, very important to bring in. But almost like we should have summits, to really talk about this, because it is a major problem in this community.
So I want to allow for, Dr. Lauren DeMello from our team, who's also with us remotely, to add to this, but a lot of it is working with our partners to get to that 1 + 1 = 3 as far as getting the word out. You mentioned Summit, Mental Health held by Fordham University just earlier this week, as an example. Also, we work with our partners to help spread the word, and we put a good number of resources on nyc.gov/vet mental health. But I want to just defer to Lauren to add anything else to that, just so you have the full idea of what we do to try to penetrate here.
Does DVS or the Mayor's Public Engagement Unit collect data on the number of veterans the program has helped?
We do.
And connect?
We do collect that as far as the number of veterans we have helped through it. In 5012, ultimately were identified as being candidates who could go and receive VA health care. Get Covered NYC Vet is our way of allowing for someone to speak with the typical PEU specialist and not only get set up with the New York State of Health for their family if need be, but if someone in that family is eligible for VA health care, to identify them, tie them in with us, and then we connect them to the VA.
So what barriers do veterans face when trying to access health care coverage for mental health and behavioral health services?
I think one of the barriers is not all veterans are eligible to receive health care services from the Veterans Health Administration, Mr. Chair. And so that's one barrier. And so we work to cover that in terms of saying, okay, what other entities can we tie you in with? Another barrier is
Can you just elaborate on that?
I'm saying, not everyone who served in the military is technically eligible for veterans health care, for health care.
An example of that.
An example is if let's say you were a National Guardsman and you never deployed on federal orders. So we had someone who worked on our team for a while who was 8 years in National Guard but never deployed on federal orders. She is not eligible for VA health care, as an example. And so there's certain things that are carved out where if you don't have a certain amount of time in service, and it's about the nature of that service, you may not be able to access the VA for health care. And so that's why we make it a point to really tie them in with whatever's available as far as our local partners on the ground and other nonprofits. That's one example. Another example of an issue as far as not a barrier, but just the perceived, I don't want my employer to know that I'm wrestling with something, and I want to maintain my privacy. That's another thing that can be a barrier to someone looking to access these services. So yes.
And I'll just jump in, Councilmember.
I'm sorry.
I'll just jump in on that. By the way, it's good to see the council members and the Mental Health Committee. I love when we join together because sometimes we just see the views of the committees we're on, and then when you get to do a joint hearing, you get to hear about veterans issues in the Mental Health Committee. And that was a tremendous resource when we would bring that back to veterans in the district. Chair Holden and Chair Lee, the first thing they had said was identifying, and the commissioner said the first problem is identifying the veterans. That's one of the barriers also. And the 51 council members play a pivotal role in being able to break the barrier down. So for example, when they were doing the ID, Veterans ID for New York City for all migrants, immigrants, and citizens. With the New York City ID card, they didn't have a box for veterans. And it took such a long time to add the veteran identifier. So everywhere the commissioner and I go, we always ask, how many veterans do you have in this organization? They don't know. And even within the labor force, within your own organizations, you always start off, how many veterans do you have? And bringing the veterans conversation to every bill, to every resolution, to every housing project, how many veterans are in part of it, then starts this conversation of, well, if we don't know, how can we know? How can my council member's district office be part of that? How can we then reach out to the VSO organizations that are doing the critical work? And how do we get the respect of the veteran to open the door so that we can help? And that's where the commissioner has been tremendous on, and I know Councilmember Palladino and Councilmember Holden now having veteran resource centers in their council office was a huge help to get to the barrier of the veterans in your district. And then this conversation, whether it's mental health or how do we help veterans, becomes more of a part of your office, part of your daily routine, because it's part of everything you do, not just this committee. So I would keep that in the background. I know we have Dr. DeMello and Ellen Greeley. We're looking this way, Lauren, because I see you up on the TV screen, but they have some critical knowledge in this area. So Dr. DeMello, I think we had a question you were going to jump in on before also.
Yeah, I think one of our greatest initiatives is the Military Family Advocate with the Department of Education. So often in these situations, children are voiceless. They don't know where to go for help. They don't know how to access care. They're silent, similar to the story that Council Member Holden shared. Through this Military Family Advocate program, we'll have guidance counselors be able to identify these children, reach out to them, therapeutically engage with them, and then connect not only them, but their whole families to our services and the plethora of services, mental health service initiatives, and we'll be able to access all the children within New York City.
Can I jump in there for a minute? I would say that one of the best ways is what you already experienced, Councilmember Holden. It's really word of mouth, and I believe that the Dwyer program is going to offer us a tremendous opportunity for our veterans to connect with services, because they are doing a program that they enjoy, and it's word of mouth that I think is essential, and building the trust with the various providers that will yield great results in connecting our veterans to services. I think it begins very much of a word of mouth experience.
Yes, word of mouth, and also, which is why I'm saying the veteran service organizations are so important, because that's probably where it starts, but also in the neighborhoods, which is really what I'm looking for. And then, but just in the general public, I remember, and I brought this up at a previous hearing, that we have most council districts have billboards and many of them sometimes in a neighborhood, and they're all peeling and they're not updated. And then when I brought this up to the billboard company, they put up a recruitment poster for the Marines, and it stayed up for years. But I think we all should have outreach. Instead of a recruitment poster sometimes, maybe we should also have a poster for a helpline, like the Veterans Emergency Crisis Hotline, to publicize that. Let me just ask you, Commissioner, and I'll turn it over to my colleague, Chair Lee. If a veteran is having a mental health crisis and needs immediate assistance, what is there a number? I don't want you to say 911. Is there a number that they could call and get help?
Well, there are three different entry points, and I'll turn it over to Lauren to add to this. It's depending on how acute the issue is in need. What we found is folks will come in through either 311, through 988, or through 911 as far as the escalation of the need. So 311, 988, 911 as far as different levels. And for veterans, it's 988 plus 1. And so as far as just different intakes when someone is in crisis, the places they tend to reach out to, Mr. Chair.
Yeah. But what
Wait, Mr. Chair, I think Dr. DeMello is going to jump in, and Ellen.
Oh,
too.
okay.
Sorry about that.
Yeah.
There's
Lauren?
also one more modality. They can also utilize they're similar to EMS, except they're more therapeutically involved. So that's another option of receiving care when a veteran's having a mental health crisis.
Thank you. Thanks for that. I just want to, what Paul Vallone was saying about knowing that there are even veterans, like in agencies, if they're arrested or if a veteran is arrested. I spoke to some probation officers. They didn't even know about the Veterans Treatment Court. Mm-hmm. So that is, to me, and we still have a lot of work to do. Mm-hmm. And I had five probation officers in my office, and only one, I believe, knew about veterans treatment. And again, that's the police. So we talked about. There's a little check mark when a person is arrested. Are they a veteran? Are they a veteran? Are they a veteran? Are they a veteran?
Anyone who touches the criminal justice system in New York City if they were a veteran. So this is an example of us working with a different organization to have them utilize. The VA has a platform called Squares, or the Status Query Exchange and Response System, where you can do a bulk upload of all of those whom you contact, and it will come back and say, these are the people here who are veterans. This is a way for us to make sure that we know anyone who is justice involved, if they were a veteran, to know who they are right away. The sooner we know, the more visibility that has for Veterans Treatment Court. And so that's how we're trying to triage that situation.
Great, thank you. And I'll turn it back to my co-chair.
Thank you. Yeah, I have to say, even the last joint hearing we had on the Veterans Treatment Courts, a lot of that still has stuck in my mind. Because, before we had that hearing, I think the last time there was an oversight hearing was in 2015. And it's amazing to me that those veterans treatment courts are not utilized more, especially when we're talking about, areas in overlap with the criminal justice system. And so I'm just wondering, it would be great to follow up to see which ones are up and running. Mm-hmm. And I remember the gentleman who came and talked, and he was saying he was the one and only, I think, or one of the few mentors.
Sweat.
Yes.
Sweat, yeah.
I remember that, and I remember how powerful that was, which is kind of connecting to my question about the peer-to-peer that you guys have, because one of the things we did with our mental health roadmap on the City Council was include the importance of peer-to-peer services, because we know how important that is in terms of someone's recovery and the success of their recovery. And just wanting to know, because what you said in your testimony here is pretty powerful. These vulnerable veterans represent the largest group in committing suicide. And so I was just wondering if you could dive a little deeper into the transition assistance program and peer-to-peer connectedness? Like, how many peers do you have at this point? How many folks are involved in the plan? I mean, not the plan, the program. And what are some of the ways that you're seeing success, or maybe more help and resources that are needed?
So, Chair Lee, I wanna, I guess, before answering that, just call out that we will never turn down someone who wants to help our veterans, regardless of whether they have served in the military or not. We always say lead with love. And so just to be clear, anyone who wants to be a part of this, we tell them go to nyc.gov/vetmentor to sign up to work with our folks. And so just to put that out there. Separately, within the agency, we have 3, peer coordinators, as far as veteran peer coordinators. These folks focus specifically on helping our veterans who have